Good morning, everyone. It's 9:30, so we're going to call this meeting to order. This is Monday, January 28th, meeting of the Together in Partnership Committee. If first we would like to go ahead and do introductions. Do we want to start this way?
Tracy Clinkfield, Department of Children and Families.
Omar Bowler, Department of Juvenile Justice.
Jean Bandish, the Brevard County Courts.
Juanita Jackson, Housing and Human Services.
Lisa Bradley, Brevard Community Corrections.
Phoebe Vitek, Brevard County Housing and Human Services. Melissa Brandt, Brevard County Housing and Human Services.
Phil Scarpelli, CEO, Family Partnerships of Central Florida.
Mimi Hanley, Space Coast League of Cities.
Doug Reynolds, Public Defender's Office.
Gabrielle Bargerstock, Healthy Start Coalition.
Chana Spear, Brevard Public Schools.
And I'm Rebecca Teeber from the City of Melbourne. Do we want to start in the audience? Do you want to go over here?
Sarah Sloan, Brevard Homeless Coalition.
Bonnie Kirkman, correct?
Chris McPherson with Children's Home Society.
Kaylin Williams, United Way Space Coast.
Maria Bledsoe, Central Florida Cares.
Steve Belcher, CEO of Steps.
George Margold, Recovery Connections.
Corey Fisher, Recovery Connections.
Stephanie Marshall, Recovery Connections.
Ira Burke, Recovery Connections.
Vinnie Perry, Program Director Steps.
Sorrel Melvin, Program Manager with Brevard Prevention Coalition.
Elmer Espinal, Brevard Prevention Coalition.
Caroline Joseph Paul, Career Source Brevard, Flag of Volusia.
Mary Beth Mish, Court Administration.
Gina Engler, Third Connect.
John McKinley, Space Coast Health Foundation.
Abby Jones, Lifetime Counseling Center.
Jeannie Rossetti, Children's Advocacy Center, FAR.
Lindsay Gregg, Brevard Cares.
April Smith from Forever Angels of FAR.
Lindsay Beck from the Drew McGuire Foundation.
Laura McCarthy, Brevard Recovery Fest.
Denise Devlin, DJJ.
All right, did we get everyone? I think so. We got a couple more coming in. Just a housekeeping item before we start. If you need to use the restroom during the meeting, the restroom right out here on the first floor is being remodeled. So if you could go upstairs to the second floor, there's another public restroom up there. So next, we're going to move to action items, which is approval of our previous minutes. For the board members, included in your materials were the May 2025 minutes, but the March 2025 minutes were included at our last meeting. They were not reprinted this time, so we're looking for action for the March and May 2025 minutes. Do we have a motion?
So moved.
I have a motion. Do we have a second?
Second.
A motion and a second. All those in favor say aye. Aye. Any opposed? I'm hearing none. I vote aye, and that motion passes. So next, we're going to move on to presentations. So first, we have the Brevard County Housing and Human Services opioid presentation from Miss Melissa Brandt. Oh, I was like, where did she go?
Good morning. I'll make this very brief. I know we have a long schedule. So really, Lee had asked us to do this to provide more information as new members are coming on board, and some people don't understand or know about opioid abatement funding. So I'm going to go through this real quick. She wanted a little history, so this takes us back. This problem has been ongoing, as a lot of you know, in treatment since '96 when OxyContin was put on the market by Purdue. But between 2000 and 2025, the U.S. has lost over 1 million people.
Hey, Melissa.
And the White House Council of
Melissa?
Economic Advisors.
Melissa, can you use the mic, please?
He asked you to use the mic.
Oh, no.
That was Logan, I think. Thank you, Logan.
Okay, thanks, Logan. The White House Council of Economic Advisors has said that in 23, which was in $24, $2.7 trillion has cost our economy because of opioids. So again, it started around 96 when the government FDA approved OxyContin. Purdue Pharma marketed OxyContin. There was a bunch of unregulated pain clinics that started popping up, especially here in Florida. And then we had around 2010 or 11 is when the drug database started, drug monitoring started, everything began to be watched. So if you look between that time frame in 2021, the U.S. lost 80,000 or more people. That's more than 10 times the U.S. military service members killed post 9/11 in Iraq and Afghanistan. So people say, why is this all important? Well, in 2022, the DEA has seized more than 50 million fentanyl fake prescription pills. And that's double the amount seized the prior year. So the opioid epidemic is obviously wreaking havoc not only on people and lives, but on the U.S. economy in general. As it looks in 2020, $1.5 trillion. We're losing people in the workforce. In 22, there were 6.3 million people missing from the workforce, which is about 1.2 million. And in 22, 82,000 people died. Now that went up, and the number preliminarily in 23 was over 107,000. As you can see, the chart lists the United States and many other countries. We lead the way in the death toll of this crisis. They have taken the term substance misuse disorder and defined it better. Substance abuse was what used to be used, and substance abuse is kind of more of a negative term. So the opioid use disorder, you may see OUD, it places emphasis on the disorder, not the person. In America, 314.5 out of every 1 million persons between the age of 15 and 64 are dying from drug overdose. I put this on here. This is DCF, the state of Florida. This is the dashboard. Just that you can go to DCF's website and find the opioid information. This is the whole state between 2018 and 22, and you can break it down into categories. For instance, it tells the total number of state drug arrests, overdose deaths, and different statistics. Same with, you can narrow it down if you don't know by county, and you can find out Brevard's information. So I just wanted to share that. And then tell you about the lawsuits real quick. So the total nationwide lawsuits are about $50+ billion, and those will be distributed over 18 years, which we're about in year 3. So we've got about 15 years left. Florida is approximately going to see about $3.2 billion, and $84 million will be given out in the naloxone, what's already been done and to come by Teva Pharmaceuticals just in the settlement, and there are others that are forthcoming. Brevard's funding is about $44 million over the total of 18 years, which looks like to be 22 through 40. And those pots of money come from the state. So the state has a fund, and that is about 45% of total dollars. And then we have a regional county fund, and Brevard is an entitlement county. We are over 300,000 individuals in the county. We will be receiving about 40%, and the city county funds are about 15%. So that's kind of how the funds are broken out. And the Brevard timeline just takes you through basically in 18 when the legal counsel began with you can look at it where the lawsuit was filed in federal court, and then the Brevard County Commission approved the update to your resolution, which created the 2 subcommittees for opioid abatement. And then it just goes on through the timeline to bring you to where we are today, which is in the 2nd year of the RFA is getting ready to go out, and the funding's getting ready to be put out on the street. So it looks like here the state of Florida, $205 million in the year 1, with 173 appropriated by legislature and the remainder in investments. The regional fund for Brevard dispersed in April of 23 was $6,572,894.67. And in year 1, the city county funds dispersed were $509,458.92. And I have this electronically if anyone would like a copy. I put a link. You can actually go to floridaopioidsettlement.com and get all the information through the state anywhere that you would want to search or research any county. So to bring you back to year one, there was a review committee who selected 3 individual topics. That was marketing and educational strategies, addressing opioid use disorder. That was education and training for medication-assisted treatment providers. It was enhancing and expanding medication-assisted treatment, and expanding warm handoff services. And of those, the county received bids for the marketing and educational piece and for enhancing and expanding medicated-assisted treatment. So in 2022-23, June through September, there was a TIP review subcommittee. They developed areas and focus from the opioid abatement plan. The RFP was developed. There was a posting and response. And then there was TIP Subcommittee B, which is the recommendations and award committee that went into action to actually look at who applied and make the selections for what we have going on in current and present real time. So there were 3 agencies respond to the RFPs, and then phase 3, there was contract execution, data tracking, and we've been involved in monitoring their contracts, tracking the data, and then mobile MAT units from Circles of Care and STEPS went under contract, and they are out in the community with the mobile MAT services. And then now we are here at a point where the subcommittee of review has met again and selected the criteria, and there is a draft RFA that is being worked on at this time. The request was from the review committee this time was to deal with treat opioid use disorder support people both in treatment and recovery, address the needs of criminally involved justice, the people involved in criminal justice, that's pre and post adjudicatory, and prevent opioid misuse. So those are what we're going to address in this round as it goes out soon. Also, there's just other initiatives, if you're interested, in the state of Florida that are going on, that the state has going on with their funding. If you need any type, if you're not familiar or you want to be more familiar, good references are the statewide response agreement, the Together in Partnership resolution, that's for you all here to understand, and then the Brevard County Opioid Abatement Plan. And then there are links also that will tell you pretty much anything that you would want to research around Florida and the settlement. Florida counties have to report both the financial and annual implementation plans to the Department of Children and Families through the data and financial management system. And the opioid funds are based on annual estimated figures and definitely could fluctuate based on if distributors, manufacturers file a bankruptcy, or if there's unused funds, or if new settlements come about. So those funds aren't necessarily set in, concrete. Any questions, concerns?
Any questions for Melissa?
Thank you.
I did.
Yes.
You can't get away that easy. No, very good, very informative, appreciate it. Maybe for some of us aging brainers, remind us, what is the definition that makes Brevard an entitled county? Is there a?
It's over 300,000
okay.
residents. It's the size.
Capacity, okay. And then the other one is, interesting about language, right, and misuse, abuse. I understand the connotation concern area. Is it going to change about access to services in any way? Does it help open doors for?
That I don't know. I think, to me personally, and being involved through all the years, when I'm reading material and I'm looking at material, substance use disorder makes so much more sense, and helps to possibly guide people to say, I do have something that's, it's less personal and more of I have a medical issue or I have a disorder and I need to go get help, rather than to say, I'm abusing substances.
Right, it's.
So
right.
to me, the connotation, I find it more inviting, that maybe I'm wrong, but for people to maybe want to get help that might not otherwise have.
Great point. I
And
agree.
I think too, with some of the things that we have looked at through the review committee, the language that is in there is for anyone that has been affected by the substance misuse. It's not just the actual individual.
Great
So
point.
there's other
Yeah.
services available to help the other family members and the other people. Yes, so whereas before it may have just been that individual.
Great point. Thank you.
Any other questions for Melissa? Yes?
You said the RFJ will be out soon. Do we have like a soon timeline, something, anything?
Our director.
Good morning, which is why I sat up here this morning. I knew we would have some questions for opioids. So right now, we are up under the final review for the RFA. We definitely want to get this out on the street and have the recommendations committee make a selection so we can go forward with contracts October 1. So it is our plan to have contracts ready October 1. This has been a learning curve for our department and for purchasing. And our department has had a lot of RFAs that just went out. So our CDBG RFA went out, we got that in. We have Houston Lane, which is an affordable housing project. And so opioids is just trying to get everything in the rotation and get to it when we can. And, but definitely trying to have the contracts October 1 with that. And later on in the agenda, I have a decision that you all need to make so we can have that recommendations committee ready when we get those applications to keep our process moving.
Will the applications, October 1 will be the applications to be submitted, or they?
No, the contract, no, we're going to get we want to go to contract October 1. And so we want to have the applications as soon as we can get this finalized and out on the street. So then in August and September, they're going to be coming in, have the recommendation, and even if the contracts aren't ready October 1, they'll start October 1 and can retro back. But our goal is to have contracts ready October 1 to implement. And we're going to do the regional funds, and then we're also going to do the county funds, those separate funds on both.
Thank you.
Mm-hmm.
So if you're a member of that review committee, it sounds like they're going to be fast and furious for the next couple months to get that out. So just be prepared for that.
Absolutely.
Okay. And I just
Thank
want to
you.
say thank you to Melissa before she sits down. She's going to be leaving us, but moving on to bigger, better things for her. So we appreciate her service to the county. Thank you.
See you, I will be out in the trees.
Okay. Thank you.
Isn't that contingent upon the board's approval of that leave?
All right, so we're going to move on to our next presentation, which is Recovery Connections of Central Florida. Good morning.
Did you have a flash drive?
No, we had emailed it over. Okay, let me, I might have.
I guess this is the high point of being able to dance for a while, I guess, while
You're good.
Corey gets the computer. My name is George Margolis, and I'm the Chief Executive Officer for Recovery Connections, and Corey Fisher is our Chief Operations Officer. I'm also a person in long-term recovery, and I find that's important for what we do here at Recovery Connections. And so before and while he's doing that, I could go over a couple of things. Our mission for Recovery Connections is in essence to take the lived experience of our staff, primarily made up of peer support individuals, to help individuals that have a substance use disorder connect with the resources and the recovery elements that they're looking for in the community. And we are a recovery community organization, which by definition is a organization that acts as a bridge between government entities like yourselves, Health and Human Services, treatment centers, and the general recovery community at large. And as a RCO, we are a nonprofit organization.
Go ahead.
Oh, you're right.
Don't mind Logan.
No, that's okay. So as a recovery community organization, as I started to say, we are a nonprofit organization. We're a grassroots organization. We were formed by a grassroots operation, and we'll go over that in just a minute. And in addition to that, it's peer-led, so we want individuals to be helped by individual peers. And we're here to create synergies with the community at large, the recovery community. The organization got started in roughly 2018. At that time, the Aetna Foundation, through a grant provided to FATA,
Oh, you got it.
well, I got that one.
On the fly.
Good job, good job.
I'll skip through the first two since that was what I was just talking about. So in 2018, as I mentioned, we got, there was a grant submitted by Aetna Foundation. They were wanting to promote the creation of recovery community organizations throughout the state of Florida. At the time, back in 18, there were only a handful, maybe 6 or 7 throughout the state. And they wanted to propagate that because they saw that there was a lot of success. So they funded FATA, and a listening session was put together of the recovery community. There were about 30 of us that attended the initial meeting on that. That's where I personally met the folks from Central Florida Cares at that time. They were in attendance at that session. And the purpose was to have a set of listening sessions to ascertain and develop a criteria for a recovery symposium. And that recovery symposium was held in 2019. It was held with 300 plus individuals in attendance from all sorts of individuals in the community, faith, government, the recovery movement, and such. And there was a lot of time spent going over what the recovery community organization was going to be like in the Central Florida area. And so it wasn't a dictated series of events that led to where we are today. It was a grassroots effort to get where we are today. In 2020 and 21, an awful lot of activities took place. We had a strategic planning session that was actually paid for by the Department of Children and Families, which is kind of cool. We also formed our 501c3 federal designations. We created a 5-year plan, strategic plan. We created a name, Recovery Connections of Central Florida, a mission, a vision, all of the things that you needed to do. We launched a website with a small grant from the Osceola County Sheriff's Department, and that has served us well, and we're now on phase 2 of our website, but it was really cool. But most importantly, we got our initial funding from Maria Bledsoe here at Central Florida Cares, which would have been about 4 years ago. And so that leads us to opening a recovery community center in Orange County in 2022, July of that year. And we also launched our 24/7 hotline, which is 407-RECOVER. And I do like to point out, we didn't pay for the name. It just happened to be available at Spectrum. Who would have guessed? And so that led us to some successes there, which brought us to opening a community center in Seminole County in September of last year. So both of those facilities are quite large. They're about 6,500 and 5,000 square foot each. And we have now grown the organization up to just about 44 individuals, full-time people, all of which, or most of which, are in recovery. Part of what we did in 23-24 was we started to perform some services out in the community through the creation of a mobile peer support team that Corey started, and that allowed us to go out into the community and start to go to some community organizations to provide peer support services. The other thing we wanted to do was to provide services to the problem-solving courts, the drug courts, and so today we're in Brevard County court system, we're in the Seminole County court system, Orange County, and the Osceola County court system. And that leads us to the final part of this slide, which is that through another grant from additional funding from Central Florida Cares, we've been able to, last month I signed a lease for a center in Osceola County, and last week I signed a lease on a center here in Brevard County. And so we expect both of those operations to start in the October timeframe, September, October, plus or minus, depending on things that we have to get done. I don't know who clapped back there, but thank you very much. And so just to point out some of the obviously, Central Florida Cares, the Department of Children and Families, is our primary funder. We do cover, obviously, now the four counties and have representation there. And so here are some of our service partners. In addition to Central Florida Cares, we have a large wraparound services contract with Seminole County government, where we provide all sorts of services for them as a prime contractor with subcontractors below who we support. We have contracts, and they're all long-term contracts. Orange County Drug-Free Coalition, so Orange County is a provider of funding for us. We have partnerships with a number of folks, STEPS is mentioned. We have memos of understanding and contracts in place with Circles of Care, Parish Hospital. We're doing things like in partnership with Park Place Behavioral in Osceola. We're working to help implement the CORE program in Osceola County. We sit with the Seminole County CORE team as well. And we have grants from Orlando Health, Advent, and partnerships with all the folks that are up there. So the next part of the presentation, Corey's going to actually go into what recovery support services we provide.
Hi, everyone. How are you doing? It's good to see some of you and some of the new ones. I'm Corey. I'm the Chief Operating Officer for Recovery Connections. Recovery support services are essentially services provided by those with lived experience. They're people who have gone forward in their life. We focus on recovery capital, which is an evidence-based model. So recovery capital is the intrinsic and external resources that a person possesses to maintain or sustain their recovery. So if you think external resources, housing, transportation, food scarcity, employment, access to communication, access to food. Internal resources, self-resilience, time management, self-reliance, stress management, accountability, things like that. It's a Likert-based scale. It's a questions from 1 to 35, answered 1 to 5. From there, we can kind of see what domains in their life they're lacking in, and then we build SMART goals and hold them accountable in weekly peer support sessions where we work with them through the process. Whether they're still in active addiction, they're new into recovery, or been in recovery for some time, everyone has goals that they want to work on and continue to move forward in their life and self-actualize. Through a lot of our services, we have the internal resource database. So there's over 200 different partner facilities that we work with and are in communication with to help provide those services. Again, whether they're still in crisis, they're in the beginning stages of recovery, or they're looking for more support, we're able to help them with that internal resource database. The 407 Recover helpline, it's always manned by a live peer specialist, so you don't get press 1 for this, press 2 for this, please leave a message. 24/7, you can call in and access that hotline. That's not only participants, that's case managers, law enforcement, EMS, hospitals. Anyone can call in and access that database for us as well. Some of our statistics, so our data shows that 90% of participants improve their recovery capital. Those that score the lowest show the highest increases in scores. Year to date, we have about a 69% retention month to month in services for our participants. That means 69% of people that are engaging in service with us stay in those services. Year to date, 1,440 new participants enrolled, with about 393 people per month on those active caseloads across all 4 counties. This is our community impact since we started services July 22. 3,349 participants have been served with over 14,000 recovery support sessions and over 20,000 completed participant goals. So those are those individual goals that a participant denotes: looking for a job, finding access to housing, finding access to treatment, finding access to a therapist, getting food, going back to school, getting a cell phone, reconnecting with their mom, getting their children back in their life. Those are all the different types of goals that we help those participants with. We have 3 different program verticals that George touched on. So one are those recovery centers. We have one in Seminole and Osceola counties, as well as Seminole and Orange counties, soon to be Osceola and Brevard. We're part of the Just Involved system. So like he said, we're in the 9th and 18th Circuit Courts as well. And then that mobile recovery support, which is near and dear to my heart. So not only do we bring our services out to community partners, but I feel like we fill the gap in care. So I started as a peer support specialist, and I don't know how many times I got a phone call from someone saying, I went to detox and now I'm sitting on the curb, what do I do next? No one helped them continue that pathway. So we want to make sure that we're there from crisis through treatment and when they reintegrate back into community as well. These are the 4 centers so that you guys can all see. So our first and foremost was Forest City Road. That's our Orange County location. We opened the Cherrywood location in Longwood back in September of last year. And again, we are working to open our Oak Street location right in the heart of Kissimmee. And then the Melbourne location, we are actually going there right after this to go take a walk through.
Excellent.
This is just another slide of all the different services that we offer with the Brevard location as well on there. These Recovery Support Center locations, they're drop-in oriented. People can come in immediately for services. Appointments are great for follow-ups, but no appointment is necessary. You can walk right in and get services right away. We have recovery-supported activities, recovery meetings, a lounge. We also offer Narcan to the community as well. And then that is our presentation. Thank you very much.
Thank you. Any questions for Recovery Connections?
You know, I want to thank you for what you're doing. We share the same catchment area by which we serve families that are vulnerable and in need. I don't know to the depth of which we are partnering with Family Partnerships, formerly Brevard Family Partnerships, but I'd like to take that to the next level. I think, you know, today is, it's Monday. What a great day to start, you know, elevating something. And I don't even know, and I apologize, I should know this, whether we have an MOU with or not.
I don't believe we do.
We will by 5 o'clock.
Okay, that's fine. Send me an email.
This is your guy.
If I may, we need to partner. I mean, you know, the audience probably knows a lot about our organization, and I want you to know that statistically, you know, the 3 causalities for removal of children in the nation is domestic violence, mental illness, and substance abuse, right? So it would behoove us that we take our relationship to the next level because given the growth of Florida, given the complexities of substance misuse and the disease behind it, right? As was said in the earlier discussion, I am proud that the professional community has integrated peers. You know, research globally is yielding tremendous outcomes because of the impact and credibility of peer support individuals. That has changed the platform and outcomes for many, many people. You guys know it better than I, but I'm seeing it. I'm reading stories about it in casework. And then last but not least, I'm wondering, you know, after we get this MOU off the ground, I'd like to see you engage with, and I'll set this up, with our dependency case managements. We can do county by county, but I really need to know how to leverage you all, and you don't need to know how to leverage them when dealing with family issues and substances. So thank you for your presentation. This is near and dear to me.
Thank you. We appreciate it.
Any other questions?
Yes, I have a question. How do you integrate your services with the juvenile population? I'm very interested in that because of the fact that, you know, as juveniles, oftentimes they feel that they're impervious to substance abuse issues, that it's an adult issue, it's not something, they're just experimental. So how do you engage in that? And do you have peer support for that group as well?
Yeah, so we are currently working on an entire youth program currently, so I'm slowly building that out. I believe there are about, the number might have changed, there's only about 21 youth certified peers in the state of Florida, 4 of which work on our staff.
Excellent.
So we are slowly integrating into those youth services. Shani Sloan, if you'll ever hear that name, she's phenomenal. She works with the youth as well. She does it as per diem, so if we need to work with a youth population, we have her meet with them and go from that. But we are slowly working on a juvenile population right now.
Thank you.
You're
Appreciate
welcome.
it.
Any other questions? We'll take your comment, Laura.
Hey, Laura.
I just want to say, you know, having served on the opioid misuse task force, one of our action items was to get peer recovery support specialists in Brevard County working actively among our medical, you know, law enforcement agencies So this is like a true answer to prayer and hard work in our county. So thank you, George. Thank you, Corey, for fulfilling the vision of the action item that was placed years and years and years ago on the opioid misuse task force. Thank you, thank you, thank you, thank you.
Thank you, Laura.
Thank you very much, everyone. We're very excited to see what you bring to Brevard, so thank you. One more?
Yes. I can do that. It's on my computer. I handle all the contracts.
You'll have it by the time the meeting's over. Thank you
all
very much.
Thank you all.
All right, so we're going to move on to our member reports. Thank you. So first, we're going to start with family strengthening or infant mental health. Do we have someone for that report?
Yes.
Yes, okay, sorry. I was trying to scan. Go ahead.
The Family Strengthening Subcommittee met last Monday on the 21st.
Is your mic on?
I'm sorry.
No, it's okay.
I apologize.
No, it's okay. Go ahead.
Family Strengthening met on the 21st and just have a couple of updates and items to note. The Child Safety Initiative's annual action plan is in its final review phase. We are still looking for, if there are individuals who are interested in reviewing that plan, we welcome additional feedback on that. Healthy Families reported that they just had a state site visit that they were very proud to report. They performed very well and are hitting their metrics on virtually all of the state measurements, so that's terrific. Healthy Start has, Jennifer Floyd reported on this at the last meeting, but our online trainings have officially launched. I will send out the flyers for that. If you have any families who might be interested in participating in online trainings on a variety of different things, from basic Healthy Start services to infant safety to just a variety of topics. And all of the programs are still open, no wait lists, so accepting referrals. So if any families can benefit from the home visiting programs, we welcome the referrals. And that's all I have.
Okay, any questions? Seeing none. All right, we will move on to the Child Abuse Prevention Task Force. Seeing none? No? Okay. Have they been here?
Yes.
Yeah, okay. Okay. Next, we have Brevard Prevention Coalition. Good morning.
I don't know what to say, so I'll talk to everyone.
Either way, whatever you want.
My name is Terrell Melvin. For those who don't know, I am the program manager with Brevard Prevention Coalition. We do have a few updates today, so I'm going to start with our I Choose Me initiative. So we're finishing up programming in Brevard and Seminole County for summer. It was great. We served almost 14 sites, so we've been rocking and rolling this summer. Staff love what they do, so they've been making a lot of connections in the community and just helping the kids over the summer. We're preparing for the school year. For those that don't know, we started programming in Seminole County, so that programming is going great, and we're finishing up those summer programs as well, and we're preparing for the fall, the school year. And also we have, we're also in California, so I'm not sure if everybody knew that we were in California, but we were able to work with the YMCA in one of the cities in California, and our team out in Cali, they did a I Choose Art activity, and it was amazing. The kids loved it. We did guided painting with them, so we just showed them how to express themselves creatively. So with Better Without It, this school year and ongoing, all of the other school years, we are looking for schools, high schools specifically, to partner with us. We would like to start providing substance use prevention services for prom, homecoming, and graduation. We know those are hot spots when, students like to dibble and dabble in substances. So we would like to provide resource tables at the school, also even pep rallies where we can educate the youth and the students on, the dangers out there and what they need to look for and how to stay away from substances and, have a good time without doing drugs or alcohol. So if anybody knows a high school that is interested, let us know. We will be rolling that out this school year and moving forward So I do have some final stats for year 2 of our Better Without It drug diversion program. We received we received 302 referrals and a success rate of 95%. With that success rate, that is only drugs and THC-related expulsions. But the overall success rate, which includes non-related drug-related offenses that led to not completing, is 86%. So with our Move Into Light, we have a new Move Into Light website, and you can find that at moveintolight.org. It's amazing. It has all of the things that we're working on in the community under our Move Into Light initiative. Also, you can see our upcoming events. And something exciting under the Move Into Light initiative, we have been able to work with the Brevard County jails and provide addiction education classes, and it's been amazing. We did 2 so far, and we're going to put some more on the books. Just working with that population is great, just seeing how much they know, but also being able to provide resources to them and tell them what's in the community. Also, under Move Into Light with the Do It For P civic group, which was started in honor of my sister who passed away from fentanyl poisoning, we are having our second event on September the 20th in Melbourne from 10 to 2. It is called Do It For P Community Health Fair, and it will be in collaboration with Burrell Medical Schools, Students National Medical Association, and Brevard Department of Health, where we will be providing free examinations and education for everyone that attend. So some of the examinations that they will be providing, and this is just a little bit of bigger examination things that we'll be doing, but blood pressure checks, blood sugar checks, wound care, and vision screening. And the purpose of this event is to provide resources and education that helps reduce stressors that may lead to substance use. So if you know anybody that may want to be a part of it, whether it's volunteering, donations, anything like that, feel free to reach out to me or Stanley. And it's going to be a great event. Again, it is September the 20th in Melbourne, and we'll send out the flyers so everyone can see it or get the information. So some other information that we have with Brevard Prevention Coalition, we're hiring for a Titusville Community Outreach Specialist. We did close the application on Indeed. However, if you know someone that may be a good fit, you can let me or Stanley know, and we'll take the resume. Stanley was selected again to be a Hope Ambassador for the 2026 RX and Illicit Drug Summit. And now he serves on the advisory council, which helps spotlights our region and build national connections. Also, we are working on renaming our organization, as now we serve Seminole County and have services used across the state and beyond. And so that's all I have. And if you guys have any more questions about anything that I said, you can ask me now, or you can attend our task force meeting that's later on this week, and we'll have more information. Yes.
Sorry. At the Burrell,
The health fair?
Yes.
Yes.
Where are you going to have it at the college, or where are you going to have the?
So it's going to be at a community center in Booker T. Washington area. It's the Melbourne PAL. I don't know if you guys are familiar with that.
Carver Park.
Yes, Carver Park on Swan Street. Yes, so we'll have it at that location. It's open to all. We did select to have it in that community because one of the big things with Do It For Peace Civic Group, we like to serve underserved communities. So that's a great hotspot for that. So providing medical care for everyone.
Good choice. Excellent.
Yeah.
Any other questions?
What's the new name going to be?
We're not sure yet. We're still working on that. But just because we're starting to have services outside of Brevard County, we,
that makes
change
sense.
the name.
Yes.
Yeah.
Any other questions?
Anybody else?
Okay.
That's good.
Thank you
All
very much.
right.
Tell Stanley
Thank
we
you
miss
all.
him.
Yeah. I will let him know. He's a busy man.
He is. All right. Next, we have Brevard Homeless Coalition.
Thank you for the opportunity. I'm Sarah Sloan with the Brevard Homeless Coalition. I want to let everybody know that on August 7th, we have one of our quarterly general membership meetings, our Continuum of Care general membership meeting. The one on August 7th is actually going to be a resource fair, an agency-to-agency resource fair. So this is an opportunity for our agencies to come together, to learn more about each other, to connect, to share resources. You know, it's lovely to see at those meetings how often people just kind of linger and talk. So this is now a more formal way to do that. I'll invite Caroline up because she's my, the word like co-conspirator comes up, but that's not the right word. I don't know what the right word is. My co-lead is for the resource fair. So thank you, Caroline, for helping with that. Caroline sits on our COC Advisory Council. The resource fair will be during our typical meeting time, so that's 9:30 to 11. It'll be at the Center for Collaboration in the Space Coast Health Foundation building. If you're interested, please reach out to me. We would love for you to have a table there. We really want to attract those that are, serving the, people who are experiencing homelessness or those who are vulnerable to homelessness.
Correct.
Yeah, to say.
I just wanted to add, it's really, a lot of times we attend those meetings and just en passant, we have quick conversations, right, about what other agencies are doing. The fair on the 7th gives you the great opportunity to really network and truly learn what the other agencies in our local community are offering. That allows us to really, really serve in a wraparound way that we always talk about. If we don't know what each other is offering, then we really don't quite know how to wrap around. Right? So take that opportunity, and we would really love to see you come in and participate. And it's for a short time, so, yeah.
And as always, we have coffee and food. You should have led with that. I should have led with that.
Coffee.
Thank you.
Thank you. All right, next we have Family Partnerships of Central Florida.
Yes, good morning. Lots to share. We are seeing trends, particularly in Central Florida and within Brevard County, the lesser of number of children coming into care for the last 2.5 months. We are also seeing a smaller number of children who are currently in out-of-home care at an all-time low, which is something to celebrate. But, you don't take it for granted. Things can change in the child protection world, and there can be spikes, but I feel very optimistic. A lot of what's happening in partnership with the greater community for formerly Brevard Family Partnership and now Family Partnerships of Central Florida really has a lot to do with the collaborative efforts on diversion and prevention. And quite frankly, it has always been known that, for every dollar that is spent in diversion and or prevention, you're saving at least $5 up to $9 per situation. So it's right for children, it's right for families, and it's good economics, it's good politics, it's all of the above. And I think we need to continue having venues like this where we're leveraging resources that really yield that kind of outcome. We have been in an ongoing state since our transition, which is now 1.5 years since we've transitioned from a singular county to 4 counties and constituting 2 circuits. We have decided quite some time ago that we were going to re-engineer the designation of case management organizations, 1 per county. We thought on a number of levels that we would have the commitment of an organization that partners with the lead agency to work on dependency case management. Historically, what we acquired was a crossing over of multiple case management organizations. For the judiciary, for the stakeholders, for families, it was getting a little bit complicated. We hope that a direction in which we take systemically will be a better engineering of more acute and more attentive effective case management services to our families. So in Brevard County, we will retain Family Allies, which is our case management agency for the last decade or so. And we have also been working with Camelot Community Care, Thompson Family Services, and Gulf Coast Jewish Services for the Tri-County area, just as an FYI. One of the things that I'd like to just extend out there is, one of the commitments that I made to the state of Florida when we took over the expansion of the Tri-County Circuits at 9 and 18 was that it's a vast geographic area. The populace is very, very different in the four counties, as you know. The culture, the aspirations and or priorities from county to county vary to some degree. So I told the department when asked, how are you going to structure a governance board and how are you going to engage communities? I want to retain a singular governance board that will oversee the vision and mission as it's carried forth by our charge through our contract with the department to the four counties. I want unity there. However, I'm looking to restructure community advocacy boards to be representative of each county, to be unique to the county, for the county, by the county. And I share that with you all because if you know individuals in the four counties, let me know who are the movers and shakers and people who want to roll up their sleeves and be a part of spreading awareness about the connectivity that needs to be represented by community-based care. It's about community, the operative word. And so what I will be doing, I just recently conducted a focus group representing a vast variety of people who are familiar with system of care models, and soon I will be now looking to recruit people from the community. I don't want large groups. I want to have small but focused groups that are going to be working on a couple of things. Bringing awareness to the dependency world, child protection, making sure that we're looking at kids in a protective factor, making sure that their well-being needs are being met, making sure that when they return to moms and dads, that just as what was spoken earlier, it's not like the job is done. It is going to be a lifelong venture for many to sustain and persevere. And so, and then, of course, within the construct of a community representation, I'd like to see communities get more involved in spreading awareness, creating engagement, and thinking more even philanthropically for all of us as nonprofits, where government is not able to provide funding, i.e., there are a lot of things that we want to enhance for normalcy for children who are in care that we don't have funds for. And there are a lot of things that are happening that through aging out that don't have funding needs that will help sustain them. We have to set a pathway of success, which brings me to a real positive thing that is happening right here in Brevard County. I've been working with Wings of Grace, Ready for Life, or Ways for Life, and a developer and our organization in establishing right now 24 units for youth who are aging out of foster care. It is going so well. The brick and mortar is done. Now the targeting of youth who are aging out has been established, and it is looking so promising that the developer now wants to reinvest another 50+ units right here in our county. We didn't have the brick and mortar to help kids who are aging out be sustainable. It's going to be focused on a transitional model so that just for a couple of years we get them grounded and then they move on, so that other waves of youth who are coming in are going to be having placements that are available to them. It will have an overlay of service oversight and mentorship and the likes, because they need that as well. I'm trying to think. I don't want to take up too much of time, but those are the highlights right now, and I thank you for that.
That's excellent. Any questions for Phil?
I just want to add to that they're actively seeking mentors. So for life skills and finances and all of that. So please do reach out to Wings of Grace Ministries. They would love anyone they'll give tours right now. Coppernaum, is it?
Yes, Coppernaum.
Coppernaum Place. It's very exciting. So.
Thank you, Laura.
Yeah.
How do you spell Copernum?
How do you spell it? Caupernam? I think that's from scripture, is it not? Yeah.
Next, we're going to move on to Career Source Brevard.
Hi again. Just wanted to highlight a few of our programs. One is the Next Gen program, and that serves young adults from the age of 16 to 24, between the ages of 16 to 24. This is a year-round program. During the summer, we do have a specific summer program that serves juniors and seniors in high school. But this Next Gen program, it's a year-round program. We also have Recovery Works, and I know some of the partners I've met with in here. This is a program that is specifically designed for individuals who've been directly or indirectly impacted by opioid or substance misuse disorder. I asked my manager this morning how many people do we have enrolled, and he told me a grand total of 3, which I'm very disappointed because we have a lot of agencies that are working directly with the impacted community, right? The next step to that is really gaining skills, whether it's through training, on-the-job training, or occupational skills training, to be able to secure employment. And so there's that other step that needs to be taken so those individuals can become contributing members in that way to the community, plus being able to support themselves and their homes. So I'm hoping that we make better strides. The program is designed to serve 39 individuals through, of course, you know that we've changed our name. We're now Career Source Brevard, Flagler, Volusia. We do need to have that officially changed again. And so there is an opportunity to serve more people. The number is small, and there's a reason why it's small, but I'm looking forward to working with partners. It's better if we work with individuals who are actually case managing individuals who have been impacted. In that way, they get better support. There's a higher likelihood of success for those individuals. The other program we have is the Non-Custodial Parent Employment Program. You may have heard me talk about this. It's for individuals who've been mandated to pay child support. They could be unemployed or underemployed and experiencing difficulties. No, we do not pay for their child support. What we do offer is services, again, that leads towards training, retraining, and employment. So again, we're looking for your support to help serve those individuals. AARP Back to Work 50+ program. That's a program that's been in place since 2015. It's directly through the AARP Foundation. And so we serve individuals, men and women, or anyone who needs the service, as long as they're 50 years or more. We provide workshops on how to be competitive in today's market by helping them create and launch a successful job campaign. We also offer one-on-one assistance to help them secure new employment or better employment. I know our community is always asking for, well, what is free? We do have a 24/7 online platform learning system. It's called Scale Up Brevard, Flagler Volusia. If you go to our website, you'll just look for Scale Up. Again, as I said, it offers 24/7. You do not have to be registered to look for work. As a matter of fact, individuals who are working take advantage of the training opportunities that are embedded in this platform. It has over 7,000 courses. So there's a course there for each one of us to improve our skills, whether it's Microsoft Office, some industry-specific courses. I believe some of those courses are also offered in Spanish. We're also partnering, this may be our 3rd year, I think, or maybe our 4th, partnering with United Way to offer money management and budgeting classes for our customers. And so if you know of anyone who's looking for work or trying to increase their skill, please have them register with us so they can attend the workshops. Thank you.
Thank you.
Any questions? All right, thank you.
All right, thank you. Next, we have the Domestic Violence Task Force. Anyone? Okay. Moving on, we're going to the Regional Children's Cabinet update and child abuse prevention. I think, didn't we say that it had a name change as well?
Yeah, well, if we could just change it to DCF updates, because
Okay.
we don't really have a,
DCF.
we used to have the 5-year plan, that's no longer exists, so that's
Got
what
it.
that update used to be. But I do want to give some updates real quick on DCF and some things happening. So on August 5th, so I think I've said this before, but on our DCF main page, if you go to just the myflfamilies.com and scroll down, it has all of the events that are public. Anybody can access. There's usually a Teams link in there, or if it is in person, it'll give you the address. But on August 5th, it is from 6 to 8 p.m., but it's the Child and Family Wellbeing Council meeting. This meeting is being held either in the evenings or it alternates, so the next one will be like 10 to 12. It gives the opportunity for folks in the community to join, foster parents, that kind of thing. We want folks to be able to participate. And this month, it's going to be Foster Youth Voice Month. So we usually do have foster youth on this meeting. They do participate, they give updates. It's a really good meeting. You get a lot of information. So if you're available to log in on August 5th, and then August 8th, we have, so Central Region is what we're under in Brevard County covers. So we have our Central Region, it's our Behavioral Health Interagency Collaboration. This is through Department of Children and Families, our Substance Abuse and Mental Health Program, as well as the Agency for Healthcare Administration. Really just comes together on a region level, brings our providers together, talks about what's happening, what services there are, and how do we work on getting that, availability, accessibility to the services. So it is a good meeting. This will actually only be our second quarterly, so it's fairly new, but we are doing these on a quarterly basis. And that, again, will be on Teams this month, or actually August, right? So we're almost there.
Almost there.
Almost there. And then the only other thing I want to share is the August 14th is the Space Coast Human Trafficking Task Force Annual Symposium for Human Trafficking. It will be at the Eastern Florida State College. It's from 7:30 to 12. There'll be breakout sessions, and it is free to anybody. I think I sent it out, so you hopefully got the flyer to just register online. But there's going to be like a transportation breakout, a general breakout, and then there is one specific closed for law enforcement, but that's really just so they can talk, on cases and things they're working on. So if you can join or attend that or send your team members to that, it's usually a really good turnout, and it has and then we'll have some resource folks there too, so a lot of the providers will be there. And then we do have our dependency, well, it's not the dependency summit, it's the Family and Children's Summit that we have annually. Again, in Orlando, this is a statewide summit, but we do have folks there from all over the country. It's well attended, over 3,000, 4,000 people a year. We have incredible workshops. And of course, it ranges from anything from it's the child welfare system. So we even have Agency for Persons with Disabilities presentations. We've had Department of Juvenile Justice presentations. We talk about interagency collaboration, and then just like leadership things for our frontline teams, our investigators and case managers. But it's a really good summit, and that actually is on the website too if you want to register. It's September 3rd to the 5th this year.
Excellent.
So if you have any other questions or anything, just.
Any questions? Seeing none. Okay, we'll move on to Department of Juvenile Justice and Juvenile Justice. Did I read that right? Yeah.
Yes, you did.
Okay.
Good. Probably can drop the and juvenile justice. Good morning, everyone. My name is Omar Bola. I'm the Chief Probation Officer for Circuit 18. Just a couple of things to add. I think we've seen especially recently, Tracy, an increase in our lockout situation. So I think we're really kind of focusing on those families that are overwhelmed and unable to take care of their children. There's a growing situation where we have families that, based on a delinquency issue, a kid comes into the juvenile screening unit and they are screened, and then for whatever reason, the family doesn't want to pick them up. So that term becomes a lockout. So we try to find placement for them. It could be with a relative, it could be at a respite site, but that is a growing concern, and we're seeing it more and more pervasive. So we're really trying to brainstorm and find out ways to support the families, to support the systems that support the family in order to make sure that those kids are taken care of. Because a delinquency issue should not equate to homelessness. So that's one major issue we're dealing with. And a lot of those is, I guess, precipitated by DV cases, whether it's the parent on the youth or the youth on the parent. It creates that division within the household. So and that'll lead into something else that I talk about in a minute. We just met, I think it was Thursday, our Juvenile Justice Circuit Advisory Board meeting. That is a quarterly meeting, that is a circuit-wide meeting, and within that meeting, I actually chair that meeting, and within that meeting, we have two committees. We have our Student Achievement Committee, and we have our Pre-Arrest Delinquency Committee. Those committees meet a month prior to the actual cabinet, the main meeting. But within those meetings, I think the biggest concern we're finding, especially with our pre-arrest delinquency citation committee, we're finding that the research is showing that even those DV cases that law enforcement normally does not refer to what is known as that citation opportunity, those are actually being diverted. The citation is a form of diversion. But those cases are not being diverted, but once the state attorney reviews them, they are diverting those cases. So probably about 60% of those cases are getting diverted. Probably about another 30% of those cases are either getting no prost or no file. So that's 90% of those cases that are left out of there. The concern with that is, as we know, with cases, it takes months for those cases to go before the court. So those are months before those kids are getting services, and in some cases, especially if those cases are no pros, no file, whatever reason, a lot of them are just legitimate reasons, those families are not being served. What we're finding is that those families eventually get served because they're new arrest, and then we see them in the delinquency system again. So really offering that pre-arrest delinquency citation is really optimum. Brevard is one of the leading counties as far as recidivism rate once they receive that pre-arrest. So meaning Brevard County, when the kids go through that pre-arrest delinquency citation program, they are at a 3% recidivism rate, meaning 97% of those kids we will never see again. The problem is, like I said, we have low utilization here in Brevard County. So let me give you an example. Out of our schools, 70% of those kids that are afforded the opportunity for pre-arrest delinquency citation get pre-arrest delinquency citation. So only 30% of them are not getting that. That qualifies what I'm saying. In the community, when those kids are arrested in the community, only 34% of those kids are getting that pre-arrest delinquency citation. So it brings the numbers for Brevard's overall numbers down to 44%. Which is well below the state average. The state average, matter of fact, the statute requires any circuit underperforming in utilization to report to the legislator. So anybody reporting under 70% reports to the legislator. We fortunately report above that because Seminole County is looped in with us, and Seminole County is operating well above the 70%. So I think they're at 77. So they bring our numbers, although they don't bring our numbers above 70%, which we still report to the legislator as a result, they're bringing our numbers up. So what does that mean? What it means is the data is showing that those kids are still getting diverted despite the DV, the domestic violence, they're still getting diverted to diversion. So it means that we might need to look at our memorandum of agreement. We're looking at that data as part of the subcommittee. They're actually looking at the statute. They're looking at the memorandum of agreement that was signed by all law enforcement agencies. And they're going to come up with a plan to decide, how do we approach this? Does that make sense? Is it a training issue for the screeners who are not notifying the officers that these kids qualify for it? Or is it the officers' policy that gets in the way of that? Large amount of it is the policy because, again, a lot of law enforcement agencies' policy does not require them to offer or does not allow the road officer to offer civil citation for those kids, those DV cases. And oftentimes it's at the heat of the moment, time heals, that state attorney gets it, and the kid and the family wants the program. So then they get it on the back end, but again, they've been months without services, and in some cases, now they don't qualify because they got additional charges. And sometimes those cases time and they get dropped, and again, we see those kids because they are no filed, and those cases come before us again. So really, the large push of, I think, the Juvenile Justice Circuit Advisory Board, that subcommittee, pre-arrest delinquency subcommittee, is really to focus on that because the memorandum of agreement is so old. That memorandum of agreement is probably a decade old. Most of the folks that signed that agreement no longer exist. And I think now that we have that standing data to show that those kids are getting that, pre-arrest, that diversion program after the fact, it lends us to believe that if we gave it to them before the fact, we will not see those kids. Because again, as that trajectory goes, that recidivism rate also rises as well. So that's one thing that the Juvenile Justice Circuit Advisory Board is really focused on. They also focused on that student achievement. They have a subcommittee for that as well. The other program that's really recently launched is on the probation side, the juvenile justice probation side. They have the SNAP program, which is a recent program, the grant that was awarded to Crosswinds Youth Services. And SNAP stands for Stop Down Plan. So our kids that have that huge impulsivity issue, anger management it deals with, it also deals with anti-bullying, but a lot of our kids, especially in the delinquency system, especially in the dependency system, they are overwhelmed and they have issues with impulsivity. SNAP is driven to focus on that. It is an evidence-based model that really uses a tablet interface that kids can kinetically respond to in an anonymous basis. It's a 13-week program that allows them to, integrate with it. The facilitator gets those responses, and they guide the discussion based on that. I've seen about 3 different previews on it. Currently now they have a group going on in Brevard County, and they have a group going on in Seminole County, and they're getting ready to launch 2 other groups with a 3rd group that's going to be an all-female group because they're gender-specific groups. So that's a new program that's just recently launched. I think they're in Brevard County. I think they're in their 4th week for their first group, and they're getting ready to launch their 2nd group. What happens is also, they don't just do it at Crosswinds, they don't just do it in COCO. Wherever the large population of the referrals come from, they create a wait list, and they do it there. So they got options to do it. Right now, they're focused on, I think, the Palm Bay area, and then they have one that they're going to try to do, because they got one going on in Titusville right now. They're going to try to do one in COCO based on that number of kids as well. So that is my update. Any questions?
Any question?
All right, hearing none, thank you.
I have a question.
Okay,
Yes.
go ahead.
Over here on your right. It was stop now and what? What was the P?
Stop now and plan.
Plan. Thank
Yeah.
you, sir.
Thank you.
All right, we're moving on to National Center for Innovation and Excellence. Good morning.
Good morning. Now I stand up, so. You wanna come with me? Good morning, my name is Jessica Miles. I am the project director over at the National Center for Innovation and Excellence. We are a part of Family Partnerships of Central Florida, but we are our own entity. And so you want to introduce yourself?
Sure. My name is Ruby Washington. I'm the lead family coordinator.
So, so what was going on at the National Center, we had our 2025 National Wrap Around the World Conference in June. It was June 25th through the 27th. It went really well. A lot of practitioners from all over the country, Alaska, came and just learned more about wraparound. We had several, which is, if you don't know about wraparound is a way or a methodology of working with families to include their support. They have family voice and choice. It is their choice how they want to work with us. And so Brevard Cares is utilizes wraparound to work with families here in Brevard County. So we are working with Brevard Cares on the Brevard Behavioral Health Expansion Grant and it's been going well. We're about to wrap it up in September for our first year. It is a 4-year grant that is designed to help families who are impacted by children with serious emotional disturbances to get access and gain access to evidence-based mental health services, services that are really going to help these families move forward in a good way so that we don't have them going into other systems. That is the purpose, prevention, prevention, prevention. So we're about to wrap that whole year up, and we're excited because we're looking at our goals and our data. And I will be sending those out. I'm not going to bore you with those, but the team is currently serving 51 families. We're hoping to still continue to increase that number. So I'm trying to think anything else. We have really cool things coming up. Our parent support, we are partnering with the Real Church to offer parent support to 3 underserved areas. Oak Meadows, it's going to be held at apartment complexes, so Oak Meadows in Cocoa, Candlewood Estates in Cocoa, and Tropical Manor in Merritt Island. So we're working on that partnership as well. We're excited about that so that parents can get support. There'll be different topics held at each of those apartment complexes. And they will also offer tutoring for the children. So we're really trying to make sure we work on a good plan with the Real Church. They're My Community Cares, the Real Church. I'm trying to think. Go ahead. Yeah.
The only thing I would want to add is that families are able to self-refer. We do work with the CARES team that does some of our referrals, but we do have a process that families can call if you know of a family who has a child who is either at risk of or has a serious emotional disturbance. That means it's causing a disturbance in the household that could eventually lead to some of these other larger issues that we have heard about. We have a number that they can call.
Thank you.
Any questions?
Any questions? Thank you.
Thank you. I know this is weird. Hello.
All good. All right, so we're going to move on to unfinished business, which is recommendations of the committee member selection. Melissa, or Juanita, you want to take this one? Okay.
Hi, good morning again. So as I mentioned earlier, we're moving forward with the RFA process. And so with that, per the TIP resolution that was adopted, once the RFAs come in, once those applications come in, then there is a committee that will recommend and award the funding. That committee is the Recommendations Committee. The members per resolution, the standing members are representative from City of Melbourne, representative from City of Palm Bay, representative appointed by Space Coast League of Cities, representative from county government, and then 5 additional TIP members without conflict as chosen by a majority vote at a regular scheduled meeting. And so I come before you today because I want to make sure as we're moving forward with the RFA that we have that recommendations committee, those 5 additional TIP members identified and voted upon today so we can have that ready when those applications come in and get those notebooks out. The second part of that is that the sheriff has a representative that is appointed to TIP.
Mm-hmm.
We have not had participation from the sheriff. And so not the undersheriff, the Chief Administrative Officer, I wanted to get the title correct. Chief Administrative Officer Brett Carmen has reached out and expressed that Sheriff Ivey would like to have a new member appointed to the TIP committee, so I have that recommendation letter hot off the presses. And so Under Sheriff Douglas Waller will be appointed to the TIP committee.
That's excellent.
undersheriff could not be here today because both the undersheriff and the chief administrative officer, Brett, are at the FSA Sheriff Conference in Orlando. So Sheriff Ivy would like to appoint undersheriff as the member and the alternate of Chief Administrative Officer Brett Carmen. And with that, both have expressed that they would like to nominate themselves as a representative as part of the recommendation committee for one of those 5.
Okay, excellent. Do you need a motion on those separately? Because I think we could take care of the sheriff's part first, real quick. Okay.
Yes.
Do we have a motion to take that requested appointment from the sheriff's department? Okay, a motion, do we have a second?
Second.
We have a motion and a second. All those in favor say aye.
Aye.
Any opposed? I'm hearing none. I vote aye, and that motion passes. So then we will move to the additional 5 members on the recommendations committee.
Yes.
So my first question is, I know there are a couple individuals up here that did serve last time. Is anyone not interested in doing it again? I think maybe we could start there. Anyone? I'm looking at you down on the end.
I will be retiring from the Department of Health in September after
Okay.
32 years.
Okay.
So my alternate, I'm sure she would agree to do it if so requested.
Okay. Anyone else that was on the committee before and is, okay,
Is the alternate here?
She is not.
Okay.
okay. But we're going to volunteer her, is what you're saying. Okay, so there's one. You need 4 more, correct? Who did we have? And the sheriff's one, so 3 more.
Yes, so
Who were the other 3 or 4 before, I guess? I don't want to appoint someone that is not interested.
Right. And so the last time was, you said the ones 1, 2, 3, 4, 5, right? Maria Bledsoe, Abigail Jones, Patricia, and Jean Tucker.
Okay. Do we know if these people are interested in still continuing to do that? Just full disclosure for anyone in the audience, it is a little bit of work. The meetings are a little lengthy. There's not many of them, but I think the one meeting we had last year was an all-day meeting. So just before you volunteer, it is a little bit of time.
It is dependent upon how many applications come in.
Yeah.
And so just to give a little background for what will happen is as those applications come in, they're going to come into purchasing. Purchasing will do their review of the applications for their forms and sections. Then the applications will come to Housing and Human Services. We'll do the review to make sure that all of the attachments and all those requirements are there, all the background, financial, and all of that. Make sure no one is disqualified because they didn't meet all of their requirements. From there, we will put all the applications into notebooks for the recommendations committee. We'll deliver them to them for them to review so that they're ready to make those awards at the awarding meeting. And so just depending on how many applications come in, that could be an all-day process. We have no idea until that happens, how many applications, but with the amount of funding that we're going to put on the streets and with the priorities made by the review committee, it could be a lot of participation. And we'll try to feed you too.
We did have delicious lunch last year.
So there is that.
Yeah. They fed us well. So you need a decision on this today because the next meeting is not until September, correct? Okay.
So can I ask, did you already reach out to Jean Tucker, or is she?
We have not reached out to anyone. It is, just because you served last time doesn't mean that you serve, this time. So we just need 5 more.
There's, I think, two are here.
Well, we need 3 more, I guess,
Yeah.
right? So we have the health department, we have the sheriff. and
Abby's
then-
here? Okay.
Maria's here and
Maria
Abby's
is here, but,
so-
yes. Yeah.
Again, if no problem doing it, it's a great, unique experience, right? But in the same aspect, because we don't have a clear RFP of what's actually been coming down for funding, if I'm serving on these committees and there's, 10 contracts to look at, if my agency is going for one of them, how do I rescind from sitting even in that discussion?
Yeah, I think that's
Yes.
that's a problem that we run into, is several of you
Yes.
probably have a potential conflict of interest.
I can give out the priorities.
Well, but weren't there are priorities, but the RFP was also supposed to be structured for anything that's in the
Yes.
abatement plan. So anything that is in the approved county abatement plan, an agency could apply for funding for, and then
Yes.
we could be potentially missing a member.
And what we're gonna do, just to give more detail of it, which is we working with, purchasing, just to make sure we put out the RFA in a manner that it's clear that the agencies that are applying what they're applying for. And so what I think we're going to do, I like the idea, we're gonna put out 4 separate RFAs. So we'll have a RFA out for support people in treatment and recovery, a RFA for address the needs of criminal justice involved persons, a RFA for prevent misuse of opioids, and then an RFA for the other,
Okay.
which is what we discussed in all of the approved sources.
Okay.
But that is a potential conflict that if your
Right.
agency applies for, then you wouldn't be able to vote on awarding.
Well, given the prevalence of someone who is nominated and accepts, having a conflict at some point in time is, pretty high. I mean, I think that if they can recuse himself from an isolated RFA application, then allow them to do so.
Right,
It doesn't
and
stop
that's-
the process.
Yeah.
And that's
Because if
why
we-
putting out the 3
Right.
separate might help, because we'll, no, but then as they're coming in, they'll have to recuse, yeah, so.
And my fear is that if we said, if you're going to be a potential applicant, we're going to lose so many people to be on the panel, on the board, so.
And we can make the decision at that time, because is what you're
Yeah.
saying, right?
Yeah.
Because we
Yeah.
won't know. Mm-hmm.
Yeah.
I guess I wish we would have had more time to do this so that we could actually seek applications or seek people that would want to participate. It's very difficult to sit up here and just randomly select people. So I'm not quite sure how to move forward with that at this
It was
point.
my understanding it was discussed at the last meeting.
It was tabled at the last meeting.
Oh, it was tabled, but there was no discussion?
Correct.
Okay.
Yeah. You're also missing a representative from the city of Palm Bay. So and I'll reach out to them again. I tried after the last meeting, but they've had some transition over there, so they lost their, so I'll be happy to reach out with them again and get with their city manager. But so that's a potential 4th seat that you're missing at this point in time. So what is staff's recommendation, I guess?
Say it again.
The city of Palm Bay
Is the seating one.
Correct.
It's in
Yeah,
the
the city of
structure
Palm
one.
Bay,
To know who they're assigned.
they need to appoint, they
They just
do
need
it.
to appoint
Yeah,
someone, so
I'll
we'll-
stress that to them.
Right. But if we could just get the potential of the 5, and then have the committee.
I'm not sure how to do that without,
Was there anybody that's interested? I'm interested.
okay, so we have
Thank you.
one that's
Yes.
interested.
Okay.
And you want to do it again? And, okay, so you have 2.
So we have 4.
Okay.
So we just need 1 more.
I knew that, I cannot think of his name at this moment in time, from, what was the Daily Bread. He worked with people with drug addictions and all that. I cannot think of his name.
Jeff Jeff News?
No, the one underneath him. I can't think of his name. You know who he is.
Keith?
No.
Oh.
Who? No, it's a gentleman. I cannot think of his name. When I told him I was on here, he expressed interest in working with us.
Okay, I think they also have an interest in.
I know, that's kind
Yeah.
of one of those.
I'm not trying to exclude them, but I
cannot think of his name. You know how
Yeah.
we've all gone through everybody around there, and everybody's, when he says his name, everybody's going to go, oh, yeah.
I mean, I reached out to Jean, I can find out, I just don't know if she's interested, but if she did it last year, she might. Jean Tucker with DCF,
Maria, Maria will
Maria
do
said
it.
she'll do
We
it.
need Maria.
So what are we doing?
So do we want to put Jean's name?
I don't know, I mean.
And
then
Palm
maybe
Bay
an
is
alternate.
going to have a voluntold individual. right?
Well, but yeah, Palm Bay is in the other 4
That's
seats
in the
that are.
other, right.
Yeah, they're not in that
That's in
4.
the standing. So that, with Maria, that's 5.
So is that Oh,
So that's your number.
Department of Health, the alternate for Patricia. You
Okay.
have sheriff, you have lifetime counseling, the state attorney,
Public Defender's
public
Office.
defender's office, and
Central Florida Cares.
We're good, okay. So
Thank
we're
you.
good? Okay. So do we want to make a motion to accept those recommendations?
So moved.
Motion, do we have a second?
I'll second.
We have a motion and
And
a
you
second?
didn't think it was possible.
I'm glad we did that. We have a motion and a second. All those in favor say aye.
Aye.
Aye. Any opposed? I vote aye, and that motion passes.
Excellent.
Okay,
Thank you
we-
so much for that,
Thank
and
you,
then
and
we'll
thank
send
you,
out the
those
information.
that volunteered, thank
all.
you.
Thank
Yeah,
you.
Thank you, guys.
So we are right at 11 o'clock, so we're going to move, we have no new business. We're going to move on to public comments. I would just ask if we could keep it kind of brief because we're at the end of our time today. So first I have Laura McCarthy from Brevard Recovery Fest.
Hey, everybody. Good
Good
morning.
morning.
Laura McCarthy, Brevard Recovery Fest, coming September 13th at the Melbourne Auditorium. First of all, just thank you, everybody that's registered. I think a majority of the room is registered for the fest. There are a couple of you that are still lingering, and so we're just waiting patiently for your decision, but thank you. We can't do what we do without you. I mean, I don't exist without you. This is a community-driven event. We are not funded by any federal grants. It's all local community collaboration. So thank you, thank you, thank you. I will say I got to do a crisis intervention training with Seminole County Sheriff's Department and trained 35 new deputies on the neuroscience of addiction and understanding the disease model. It was awesome. We had a lot of fun. Yes, I'm going to go back and do trauma-informed care with them with their advanced CIT training. So that felt like an Olympic moment, really, to get to do that training with them. Also, I want to thank all of you because I was nominated the nonprofit hero for Space Coast Credit Union and Melbourne Chamber of Commerce. And you think, Laura, you're tooting your own horn. No, I'm not tooting my own horn. You all get credit for that because I only do what I do because of you. So I want to pass that honor. You are all my heroes, and I can't thank you enough for everything you're doing in the county and for the endless work and hours that you're putting in. I just thank you, thank you, thank you, thank you. Last but not least, I think I may have reported on the mental health event. It was a huge success. Thank you to everyone that participated in that. They are talking about doing it again next May for National Mental Health Month. So thank you, thank you, thank you again for the event, and hope to see you all at the fest September 13th.
Thank you, Laura. She got applause. Next, we have April Smith from Forever Angels of Brevard. Good morning.
I'm not really good at this public speaking thing, so
That's
I
okay.
wrote everything down. I did send an email, if you can pull up the pictures on here, or no? Melissa? Okay. All right. Good morning. My name is April Smith, and I stand before you today as a recovered addict since 2011, a survivor of domestic violence, and a grieving mother, sister, and cousin. These deeply personal experiences have led me to my life's mission, founding and directing Forever Angels of Brevard, a 501c3 nonprofit organization. Our mission is to support families who have suffered the unimaginable loss of a child, sibling, parent, or close loved one. We also walk alongside individuals battling substance use disorders and mental health challenges, ensuring they are not alone in their journey toward healing and recovery. At Forever Angels of Brevard, we believe that no one in our community should have to grieve in silence or struggle without support. We provide compassionate outreach, memorial services, grief counseling, resources, and advocacy. For those seeking sobriety, we offer tangible help, assisting individuals who cannot afford extended rehabilitation and/or life-saving medications such as Brixadi, Sublocade, and Vivitrol. We are actively working with the Drew McGuire Foundation to establish a relapse prevention dual diagnosis and sober living facility, a vital step in addressing the root causes of addiction and providing long-term sustainable care for those in need. Our work, I just sent them today. Oh, don't worry about it. Our work also includes raising awareness and providing life-saving tools. We distribute free naloxone, CPR responder kits, and offer hands-on training for overdose response. Our goal is to place naloxone stands throughout Brevard County in high-traffic public areas equipped with both medication, Narcan is a brand, and instructional guides so anyone can save a life when seconds matter. We're engaging with Brevard County schools and jail systems and aligning our efforts with programs like Fentanyl Fathers, Scared Straight, and Victoria's Voice Foundation to educate shared life experiences and prevent future tragedies. I'm proud to invite you all to our second annual Forever Angels of Brevard Bike Poker Run, taking place on Saturday, August 30th in partnership with Space Coast Harley-Davidson on Palm Bay Road. Kickstands go up at 10 a.m. This event is a powerful day of remembrance, connection, and action for our loved ones, our Forever Angels. We're honored to be joined by a strong network of community partners and vendors, including but not limited to Circles of Care, Brevard Prevention Coalition, One Blood Mobile Donation Center, Project Noel, Texas Roadhouse, Texas Pictures Documentary Team, Free Naloxone CPR training stations, Sandy Marks, a mom who provides handmade blankets for individuals in recovery, the Drew McGuire Foundation, American Legion Riders, and I'm proud to say, since the DEA Summit, the Brevard County Sheriff's Office will be joining us.
Excellent.
If you're interested in supporting, partnering, or participating, please don't hesitate to reach out to me. Additionally, Texas Pictures Documentary on YouTube will be filming powerful documentaries here in Brevard for a second time on August 28th and 29th, highlighting stories of loss, healing, and hope. If you or someone you know would like to share their story, we welcome your voice. And I am over that, so you can contact me for that too. On a deeply personal note, I've lost 6 family members of my own. No, 5. I lost 5. My 2 sons, Thomas, he was 32, James was 26. They were both fentanyl poisoning. My daughter Alexis was killed in a car crash, and my baby brother Randy and my cousin Mark were also poisoned by fentanyl. I have 6 children out of those 5 that are growing up without parents, either a mom or a dad, just in my family alone. And sadly, our story is not unique. We're not only honoring the ones we've lost, we're fighting for the lives of those still with us. My grandchildren and so many others deserve a future free from this epidemic. As we continue to grow, I'm excited to share that Forever Angels is expanding across Florida, including Polk and Santa Rosa counties, and into East, West, and Central Tennessee. As such, we will soon become Forever Angels of America, with Forever Angels of Brevard proudly standing as the founding chapter. Thank you for your time, your support, and your commitment to saving lives and bringing hope to families like mine. Together, we can be the light in someone's darkest hours. Do y'all have any questions?
Thank you. Any questions? Thank you.
No questions.
Great
All
job.
right. Thank you.
All right, next we have Terrell Melvin from Brevard Prevention Coalition.
Just something quick I forgot to announce. So the opioid task force meeting will be Wednesday, virtual, and it's going to be from 10:30 to 11:30. At that meeting, Lotus Behavioral Health will be presenting on their program for adolescents, boys and girls in need of residential treatment for substance use and co-occurring mental health conditions. Also at the meeting, Stanley will be giving other updates related to the opioid abatement and substance misuse prevention in our region. That's all I have.
Thank you.
Okay.
All right, I'm seeing nothing else. That's all the comments we have today. So our next meeting will be September 29th in this room. And we
Before you
will-
adjourn?
Yes,
I'm
yes.
sorry, before you adjourn?
Yes, go ahead.
Since all the agencies are here, I just want to make sure that everyone knows if you would like to apply for the dollars that we're going to have available, we're doing that through our purchasing department. They use Vendor Link. And so if you go to Brevard County Purchasing, there is a link for Vendor Link. Also, what we're going to do is post it to our department website also. On Vendor Link, there are commodity codes. And so we're going to post the commodity codes, but as long as when you register up under Vendor Link and select the commodity code, when an RFA hits from purchasing, you will get an alert. And so we're asking all agencies just to make sure you don't miss it. If you go ahead and register now, your agency, then you'll get an alert when the RFA hits. If you have any questions, just reach out. We'll be able to assist you with that. We also have our marketing campaign that's going to launch. The opioid abatement marketing campaign is going to launch August 21st at 12 p.m. It will be here at the Government Center. We're going to have a unveiling of a bus wrap that will happen out there at the Reflecting Pond. And so if you wanted to come, you can register and come to that. We'd love to have you. I will give you a business card. You're welcome.
All right, so I'm seeing nothing else. We will adjourn at 11:11. Thank you, everyone.